All right, so we are going to chat now about resources for children living in kinship care. This is going to be presented by myself and Trista. You guys already know Trista, so she's over there. She'll come back in just a minute. My name is Leah Dods. I'm the director of Kinship Support Program here at Foster Kinship. I've worked in the realm of kinship care for about six and a half years now. Completing internships, working in various positions through all different types of social work, micro, meso, and macro. I've worked as an assessment worker for kinship families, a caseworker, a facilitator for foster parent licensing classes. I've done community organizing and event planning for kinship families, as well as policy advocacy work as well. My passion for kinship care really started the moment I began working with my first kinship family and really just realizing how complex kinship care is. Kinship care has been a part of my family for many, many generations. And honestly, even when I worked with my first family, I didn't kind of even realize my family had kinship care in it because that's how normal it was. I didn't even have the language for it upon starting here at Foster Kinship. So I'm really passionate about families having equitable access to resources, because families like mine who didn't even know it was really a thing that we could ask for help, it was just something that we did for so many years. I want families like that to be able to access those resources, because if you can't ask for help, then there really isn't any help for you, right? So that's just a little bit about me. In this presentation, we are going to explore the statistics of children living in kinship care. We're going to talk about some of the disparities that exist between the different types of children in non-parental care, specifically looking at children in public and non-public kinship care, or inside or outside of the system. And then we're going to discuss different resources for children living in kinship care. And this is where we want to hear from you all as well, of like what's in your area that are innovative programs or services that are really helping families. Because I think if we share more, we're all just going to do better for kinship families. And there's a lot of us doing some really cool work out there. And so we want to hear about that. So children who cannot live with their families of origin experience multiple placement paths. So I believe that when children can't be with their natural parents, that they should be with families if that is going to be the best option for them. And it often is. So traditional foster care is going to be superior to children living in orphanages or group settings. Research shows us that, right? Family settings are going to produce better outcomes for children compared to living, again, in like a group setting. And kinship care is going to be best for children who cannot safely live with their parents, but disparities still exist for children living in kinship care. And I really want to bring up all children in kinship care, because they don't get a choice why they're in kinship care. It's not really like they didn't get a choice at the hand that they were dealt. And so we want all of them to have the same access to resources, no matter the type of care they're in, right? Whether grandma is just doing it, right? Or CPS has formally place them somewhere. All of those kids should have similar outcomes, and they don't right now. So to kind of help our conversation, I want to do a case scenario with you guys about a child named Gustavo and his grandmother, Luisa. I'm going to just read this out loud, so I'm sorry if that's a little bit boring, but I think this will kind of help our conversation as we're talking about outcomes and resources and needs that kids and families have. So Gustavo is a 7-year-old boy who is primarily living with his biological parents. His parents were experiencing homelessness, substance abuse issues, and domestic violence, often in the presence of Gustavo. He was never enrolled in school, never attended doctor's appointments, and was often handed a tablet or a cell phone to keep him quiet and out of sight while his parents were engaging in substance use. About 1 month ago, Gustavo was determined to be unsafe with his parents and placed with his paternal grandmother, Luisa. Luisa is a single disabled woman living on a fixed income, receiving only Social Security benefits. She receives SNAP or food stamps benefits, as well as Section 8 or public housing. For many months, Luisa finds herself without enough food to last throughout the month. So her SNAP benefits aren't even lasting herself throughout the month, which we know that happens with a lot of families. She's also struggling with her own mental health issues from years of unresolved trauma. Since having placement of Gustavo, she's noticed several concerns with him. She noticed that he struggles with paying attention at home, in school, and when he doesn't get his way, he has really inappropriate tantrums that can last for an extended period of time. Periodically, he opens up about witnessing violence, drug use, and going without food or shelter. He's behind in school academically, as the school placed him in the first grade, despite never going to kindergarten. He's been complaining of pain in his teeth that keeps him up at night and makes him not want to eat solid food. He's having episodes of nighttime accidents and still wears pull-ups to bed. Luisa, his grandmother, is at a loss of what to do to address all of his needs and feels overwhelmed at times due to the amount of needs that Gustavo has. How many of us encounter kids like Gustavo in similar situations? Yeah, this story, we serve over 100 kids each month that have the exact same story, right? So let's talk about Gustavo. What are some of his needs? So we know he has safety needs, right? So that's why he was placed with grandma. There's clearly stability needs. I'm not even sure he's super stable with Luisa at this point, but what are some of his well-being needs? Let's think about like medical needs that he had, if you recall. The dentist, yep, he said that there was a toothache that he has, most definitely. Primary care doctor, yeah, he's never been to the doctor before, which seems like he's been in pretty good health, but he might need to go for a checkup, right? Engagement needs, medical, social activities, therapy, an evaluation for educational services, inability to pay attention, academics, yep, and you guys are hitting those mental health and educational ones. He still wears pull-ups. So that could be like medical, right, or trauma. So kind of both of those need to be looked at for why he still wets the bed at night, which we know can be common for kids who've gone through trauma, but it could be something else. Perfect. Thank you, guys. So what are the needs of the family as a whole for Gustavo and Luisa? And we can bring in the parents too. We were just talking about reunification. So let's talk about the family as a whole. What are their needs? Food resources. Yep. If Luisa wasn't able to feed herself on the SNAP, even adding him to SNAP is not going to make that food stretch for the whole month, right? Behavioral consults. Yep. Financial resources. That might help some of those food resources, right? But also the other things that she has to buy, such as pull-ups, right? And other things he's going to need. Guidance and help getting services established, educational assessments, therapy for him, caregiver and birth parents. Yeah, exactly. Respite. Yeah, I can already see the respite that she's going to need, right? Substance abuse resources. And being that there's domestic violence, maybe some classes for that or individual therapy for the birth parents to work through some of the issues that they have or needs that they have. There's a lot of needs that they have. Support groups, yeah, for both Gustavo, I think, and the caregiver and the parents too. Yeah. Thanks, buddy. Okay, perfect. So they have a lot of needs. And throughout this, we're going to kind of talk about kids like Gustavo, right? What are the statistics of them? What are the outcomes? And then we're going to bring it back and talk about resources that might be beneficial for them. So in terms of kinship care statistics, do you know how many kids are living in kinship care in your state? If you do, go ahead and chat it out. In Nevada, it is approximately 33,000 children, and about 2,100 of those are in kinship foster care. And yeah, it's so totally okay if you don't know. Yeah, it might be. And it's crazy how much we actually get in contact with. You know, when I started here at Foster Kinship, we had like 800 families. And I'm not 100% sure what that equates to with kids, but over the last 6 years, now we have over 7,000 families in our database. So like kinship families are kind of hard to find. So I think that the numbers are a little bit, hard to determine, a little bit sketchy, because I think it's probably more than even what research shows us. Yeah, I'll show you guys a graph too of like just how many kids are in informal kinship care. So right now, 1 out of 20 children don't live with either parent. So it's basically one kid in each classroom. And some classrooms have over, I know here in Las Vegas, depending on what school, some classrooms have 40 children in a classroom. So it could be 1 to 2 children in each classroom in the United States, depending on how many kids, right? That is a lot of children living in non-parental care. I was actually looking up like other big causes of, you know, that we care about for children, not saying that all causes aren't equally important, but kinship care is one, or non-parental care feels like one that people don't really care about too much. And I think you guys probably run in contact with that too, when you're trying to advocate for kinship families or trying to acquire, you know, funding to do the work that you're doing. It can be really hard to get people to care about this, but you would think that they would, especially when we think about why kids aren't living with their parents. So why are children living in non-parental care? And you can go ahead and put it in the chat. And this is like all kids, including like children that are within stranger care as well. Thanks, Amanda. I know I'm not supposed to say names, but that's really helpful for putting the stats. Yep, drug abuse, death, military, immigration, deportation, jail, prison, domestic violence, neglect, abuse, housing. Yeah. And unfortunately, I feel like more and more children, there's like the kind of ethical dilemma between, is it neglect or is it poverty? And we're kind of seeing those differences more and more often, especially, you know, now that I guess we're in a recession now, right? Unwillingness to parent. Yeah, and children in non-parental care usually end up with relatives, right? About 83% of them will end up with a relative. And there are death, yes, that's also one too. There are very little differences between why children in informal and formal, or inside and outside of the foster care system, are not living with their parents. Pretty much the reasons are the same. And there are very few, if any, good reasons, right? Like I know we mentioned like military deportation, like it's still sad that parents are separated from the child. It's wonderful what the parent is doing. Still not great though, right? Because parents are separated from their child, but most of our children are separated due to abuse and neglect, regardless if they're in the foster care system or not. So basically our children are having similar experiences, but there's a disparity in resources, even though all of our kids have had some kind of adverse childhood experiences. And so I think it's really unfortunate that the resources are based on type of non-parental care, because all of our kids have had very similar experiences. And so for definitions of non-parental care, I know Allie kind of had some definitions as well. So I'll bring some of hers in so we're all speaking kind of the same language. Non-public kinship care. This is children outside of the foster care system. So this is informal kinship care, private kinship care, where CPS has never been involved, as well as voluntary kinship care, where CPS, the children have come to the attention of Child Protective Services, but they're diverted into hidden foster care. So those kids are outside of the foster care system. Then there's public kinship care, where children are inside of the foster care system. So these are formal families caring for children that are considered wards of the state, right? And those families can be licensed or unlicensed. And then, of course, we have traditional foster care, where children are living in stranger care. And like each one of these types, informal, private, voluntary, unlicensed, licensed, and then traditional foster care, they all have different outcomes. Some are safer than others in other regards, but what we do know is that children do better with kinship families, even if it's not perfect. So children in kinship care, a majority of children are in non-public kinship care. So that is the 49%, which is the private kinship care, and the 40% of non-public voluntary kinship care. So that is 89%. I asked my coworker to add those two numbers for me the other day because I'm not great at math, but 89% of children are living in kinship care outside of the system, and 11% are living in public kinship care inside of the system. So like we were saying before, a vast majority of children are not involved with the child welfare system, and they're kind of, caregivers are just out there doing the best that they can. And if it's families like my family who doesn't even know what kinship is, and I think I saw the comment earlier of like, after months of working with a caregiver, they ask what kin is or kinship care is. And that happens to us all of the time. And I'm like, it's you, you're a kinship caregiver. Or we'll ask a question about them being a kinship caregiver. And they're like, that's not me. And I'm like, it is you. It absolutely is you. So children in non-parental care, like I said, a vast majority are going to be, or children in kinship care, the vast majority are going to be in non-public kinship care, with a little bit of that overlap where we do have some kids in foster care, right? Kinship kids living in foster care, and then just traditional foster care. So, and again, it's kind of hard when you look at the data, like the numbers kind of change, obviously, depending on the year or what you're looking at. And again, I think it's really hard to track children who are living in kinship care because caregivers don't even know what they're doing as kinship care. So I can't imagine during the census, all of them are like answering those questions properly, or they don't want to answer the questions properly. I come in contact with so many relatives who have been caring for their kiddos for like a decade or longer, and now they're finally getting resources, and I'm like, what have you been doing this whole time? And they're like, just paying out of pocket for medical expenses and just doing their thing for 10 years because they're afraid of being found, right? When being found will just hopefully get them the resources that they need. So there is about 2.6 million children living in kinship care outside of the foster care system, about 128,000 children living in kinship care inside of the foster care system, and then just under 300,000 children are in traditional foster homes or perhaps group homes, something like that. So there are a lot more children living in non-public or outside of the system, which then tells us that most of these children are not getting adequate resources. And we already know this. We know that a lot of kinship caregivers are not taking advantage of like child-only TANF and SNAP benefits and things like that. Are there any questions so far? Go ahead and chat it out if there are. While you guys do that, if you have any questions, I will start talking about outcomes for children in kinship care. So much of the research out there is really comparing children in formal or inside the system care compared to traditional foster care. There's more and more research out there about kiddos that are outside of the system. But again, most of it is for children inside of the system. We know where they are, right? So I think it's easier to study that and get data on that. But more and more, we're trying to figure out, especially kids who have been diverted from the system. I think there's a push to get more research on those children because those are really the ones that are the most unsafe. And children in different types of non-parental care may have different outcomes, and different types of children in non-parental arrangements have access to different resources, which really creates this cycle of caregivers and children not being able to access resources and then having poor outcomes, and then they can't get resources. And so it's just like this cycle that happens over and over again until we can put measures in place to really get those kids support to get their needs met. So children's needs, we know that kids who don't live with either parent do have poor long-term outcomes compared to children who live with either one or both parents. And this is why we really want to help get kids back with their parents, and the future of foster kinship is going to start kind of moving in that direction, because if we can reunify children with their parents, they're going to have better outcomes than they are in kinship care or in traditional foster care, right? Children in kinship care also experience more needs than the children in general population. And so I want to kind of break it down based on safety, stability, and well-being needs and talk about what those are. But again, we know that different types of children in kinship care have different access to resources, which can really greatly increase positive outcomes, right? So different types of children will have access to oversight and support from a caseworker, although it is, up for much debate to what level having a caseworker involved is helpful or detrimental to the family, right? Or even harmful. Depending on the type of non-parental care, caregivers will have background checks. And I'm not saying that individuals with background issues are going to not be able to care for the kiddos, right? But it's just like another layer of protection, right, for our children. Caregivers who are involved inside of the system get training, financial support. There's better medical insurance through fee-for-service Medicaid and mental health benefits. They also have access to other quality resources. And I know some Kinship Navigator programs aren't able to serve informal families or families outside of the system. There's quite a few that only serve families inside of the system. And as we go back to like the number of kids living outside of the system, there's so many more that actually need support that way, right? Because they don't have caseworkers or any kind of support or oversight or help acquiring what they might need. So let's start with safety concerns and kind of talk about how kids do safety-wise. So we know that safety concerns are pretty much the number one reason that children are living in non-parental care. Maybe the intervention was CPS becoming involved and them removing the child formally, right, and placing them with a relative. Or maybe it was just a family decision and grandma said, this is not safe. Maybe with Louisa, she saw what was happening in the parents' home, or the parents called her and said, hey, I'm homeless. And then Gustavo came to live with her, right? While the parents try to figure it out on their own. So there's a couple of different ways that can happen. And what we do know from research is that children in unlicensed kinship foster homes were at a 14% higher risk of maltreatment compared to traditional foster homes. However, children in licensed foster homes are 33% less likely to experience maltreatment compared to traditional foster homes. So in terms of what is safest, it's going to be first licensed kinship foster homes, right? Then traditional foster homes, and then it's going to be unlicensed kinship homes. So unlicensed kinship homes are, while they may be safe, it's not the safest option. And that's why at foster kinship, for caregivers that are involved inside of the system, we do want them to get licensed if at all possible. Because we know that they're less stable and less safe. And of course, it goes back to like the training that licensed relatives receive, as well as the financial benefits that they get too. And then at least here, when a family is licensed, it's basically an additional worker in their home, right? That can provide support and resources and oversight. For stability, we do know that children in kinship homes experience fewer placement disruptions, which is really good, right? We know the more homes that children go to, that's just like another trauma, right? Another trauma, and it equates to really poor outcomes for them. Kinship families are generally able to provide stable homes compared to, traditional foster homes. And children in kinship care do tend to stay with non-public caregivers for a longer period of time. However, it's not all stable. There is increased instability in kinship homes for kids outside of the system when there are lower incomes. and infants. It's actually kind of startling that homes that have lower incomes and infants were 5 times more likely than older children to disrupt and have those infants actually placed in foster care because the caregiver outside of the system, wasn't able to do that, which there are a lot of costs associated with infants, right? And this could happen as quickly as 18 months. So it might not be stable depending on, what that looks like and how old the children are. And then children in non-public kinship care tend to stay with those caregivers for a while, like I said, which if we look back at the reunification conversation that we had with Allie, it kind of makes perfect sense because they don't have access to resources, right? What is reunification? And then depending on, the relationship between the parent and caregiver, there might be a stigma or just no clear path to be able to get them back together. So as professionals helping families achieve stability, it would be helping them, acquire education on legal and financial resources, as well as other supportive services to meet some of those needs, right? So what are some resources that would help Luisa and Gustavo be more stable? What would you guys recommend for them? What resources would you recommend to increase stability for Gustavo and Luisa? Access to financial resources? Yes, most definitely. So we might look at, increasing the SNAP benefits, adding Gustavo on there, or assessing for any child-only benefits. Or if Luisa was caring for him inside of the system, we might look at helping her become a licensed foster parent. Or I know to add him, Gustavo, to her public housing, she'd have to look at acquiring some kind of legal, court-ordered legal guardianship. So we might help her find more information on that and access support to apply for guardianship. If you have any extra thoughts, you can put them out there. Now, we know that children, when they're unable to live with either natural parent, whether it's temporarily they can't live with their parent or permanently, it really disrupts normal development for a child. We're meant to live with our parents, right? And when we're not able to, for whatever reason, I almost think like a piece of us kind of shifts inside. And so this can have really, as we all know, severe consequences on child well-being and development. And what research tells us is that children that are in voluntary kinship care, so they come to the attention of CPS, but then are diverted from the system, have greater physical and mental health issues than all other types of kinship care. But in general, I don't want to make it seem like other kinship care options are better because they're not really, right? Like all of them have not great outcomes. It's estimated that anywhere between 30 to 45% of children living in kinship care have at least one mental health condition. And a third of these kiddos have clinically elevated behavioral needs that really mirror children in traditional foster care. So like our kids have bigger behaviors, they have mental health concerns that caregivers may or may not be able to help support. And while caregivers can provide, a good home for them to live in, they might lack the financial resources to get some of these needs met. Here in Nevada, it might be similar to your guys' states, but it's really hard to find good mental health professionals or to have the insurance that they even take. We have a lot of really good psychologists here that don't take our fee-for-service Medicaid, or if they do, they have a waiting list that is months or years long to get into them for any kind of support. And And I know there are certain professionals that might contract with family service agencies and not even take Medicaid, but they'll just take only those kids in the system. And so now we have a whole lot of kids in informal kinship care that don't have access to any of that. And while I do want to focus on our children's outcomes, we have to talk about kinship caregivers and their mental health, or if they're getting their mental health needs met, because it directly affects our kiddos. So research finds that caregivers with positive mental health outcomes are more likely to experience less parenting stress. They engage in shared activities with children, and they're more responsive to their needs and help regulate their emotions. But caregivers with poor mental health are less likely to be positive, sensitive, or attentive to their kids' needs, and may pose a significant threat to their emotional regulation and stress coping. So what we see too is caregivers' mental health is like the number one unmet need, or their emotional health is the number one unmet need, which is ironic because in research, time and time again, it shows us that compared to the need for financial help or any other type of help that they need, emotional support is the number one thing that they need. So yes, we need adequate mental health support for our children, but we also need that for our caregivers too. If we want them to instill healthy coping skills in their kiddos and be less stressed out overall, or to be able to handle the other difficult things that our caregivers go through, right? Like having lack of food resources or lack of financial support to be able to care for their kids, or daycare support or things like that. So as professionals working with kiddos in kinship care, what can we do to help support their mental or behavioral health? What are some supports that you would put in place for like Gustavo and Luisa? Gustavo was experiencing tantrums, right? Luisa was already becoming very stressed out, has her own mental health issues that she's afraid would, be exacerbated from now caring for Gustavo. What would you recommend? A referral to any behavioral health? Yeah, any and all, and see which one replies first. Counseling, therapist, activities, yes. Support groups for managing difficult behaviors, yes, most definitely. That'll give her that camaraderie, but also the support from a professional to know, one, she's not alone, but give her some really good tools. Letting grandma know that they're not alone with support groups. Yeah. And I think it's really important for Kinship Navigator programs or just caseworkers working with families. I think it was said earlier, like just taking the time to talk to them, like that in itself can help mitigate disruptions or risks or threats of disruptions. Like just being that lending ear, it is really the thing that sets so many organizations apart. If you can just listen and take that time to support them emotionally. And I know sometimes we don't necessarily have the time, right? But if you take that little bit of time, I promise you, it'll save you time on the long run with that case. Therapeutic daycare or early childhood support services. Yeah. Respite care, TCIF, therapeutic crisis intervention for families. Yeah. Check-ins, most definitely, especially early on. That's a really great point. Like early on, Lisa, that Luisa is going to be more stressed out, right? So maybe it's more often phone calls in the beginning, right? Or check-ins in the beginning. Most definitely. Thank you guys for participating. So for education, this will be the last one that we chat about. And then I'll go through a case plan of what I would do to support Luisa more formally. With education, a systemic review found almost no difference in educational achievement among different types of non-parental care, but there might be some evidence to show that children in kinship care may face greater risks of low achievement. And basically, to increase achievement, they found that like caregiver support and involvement, as well as the child's aspiration and engagement, would lead to more positive outcomes, which makes perfect sense, right? I was recently working with a caregiver who is hesitant to get guardianship because she says dad sometimes comes around when, she really berates him and finally he comes around and then he goes MIA. So I'm like, well, what do you do for like parent teacher conferences or like getting them enrolled year after year. And she says, well, I just bother him until he comes and then he goes away for a while. And she's still hesitant to acquire legal guardianship, which would give her the option to enroll kids or her kids or do just the most basic of tasks, which would be to check their grades, right? She doesn't have access to check grades online or to really contact the teacher or to make any kind of educational decisions, to more complex decisions like helping advocate for a kid's IEP, right? Or a 504 plan that would really help support them in obtaining a diagnosis through a school system, right? And then finding free supportive services. And so as professionals, we can really help caregivers, through educational advocacy by first acquiring, some kind of legal support, right? And then giving them that roadmap to educate their kiddos, or referring them to somebody who might be more well-versed in that, right? There's a lot of school professionals and educational advocacy programs out there that would help families do that, but you really can't do that until you have some of those legal needs met for caregivers. Now, despite all of the deficits that I've kind of talked about, or the issues and disparities with kinship care compared to traditional foster care, there's one study that found out of 30 different variables, talking about education, well-being, safety, etc., they looked at non-kinship placements, guardianships, and adoption with kin. 24 comparisons favored kinship settings and only 6 favored non-kinship settings. So despite all of the issues, kinship care is the best option, which we all know, but I think the problem still lies in the differences and disparities for our families, which is really complicated, right? We're looking at different legal arrangements, right? For kiddos and caregivers, we'll have different outcomes, but again, our kids didn't choose to live in kinship care, so we need to put supports in place to really raise them all up. To get that same support or at least have similar outcomes. So let's revisit Gustavo and Luisa. Are there any resources in your area that you would recommend for them that would support, the therapeutic needs that they have, maybe the physical needs that they have, behavioral health? Are there any educational advocacy programs that you work with that are doing really good work? If you just want to shout them out, I think that would be really great to hear what supports you would put in place. What resources in your area would you guys recommend for Gustavo and Luisa? Title I Hope. So that would be a resource for homeless youth. Just one project for senior meal delivery. Yeah, most definitely. That would be great to meet some of those food insecurity needs that they have. Nevada PEP helps with educational advocacy. Most definitely. Our agency has support groups, therapists, and counselors for our families and YMC activities. That's awesome. Legal aid, yeah, most definitely. That would be probably one of my first ones, is to like refer to some kind of legal advocacy to help get that guardianship. I always hate when kids have like toothaches and I'm like, oh, like with a doctor, you can get kids that help, right? Because doctors have to help kids, in situations when you go to the doctor. But dentists kind of like don't have to until there's that legal guardianship. And I always feel so bad for them. Therapy, medical care grants. Yeah. Title VIII housing. So public housing, Boys Town, churches, foster kinship. Yes. Thanks, Erica. And so what are some different factors that may determine the types of resources available to children in non-parental care? So what are the different factors that might determine the types of resources available, like to Luisa and Gustavo? Less networking. Yeah. Again, you don't ask for help, like nobody's really going to know what that looks like. Or again, like having the language to talk about that. Like maybe is Gustavo in care inside the system or outside of the system? Yeah, informal versus formal. That can determine like what can the child welfare agency do, right? Or not do because he's not in care. Yeah, also caregivers' financial resources. Unfortunately, in Nevada, they still look at caregiver income when applying for benefits like child-only TANF, right? So even getting cash assistance, we know that that Louisa family, I could tell right off the bat she's going to qualify, right? But there are many families that like might just be right there, and they're having trouble making ends meet, even though, right, the income guidelines say they don't qualify because they should have enough money, right? No knowledge of programs. Yeah, does he have medical insurance? Is there a blood relationship? Yeah, that's a really good one. If there is no blood relationship between a child and caregiver, that really limits the amount of resources, and sometimes their ability to even acquire something like legal guardianship, right? Very good. So what I would do at foster kinship is we look at basically 4 areas in our case plans: legal stability, financial stability, parenting and child needs, and caregiver support. So when we're building a case plan with a family, those are the 4 things we're looking at, right? And if you remember talking about our model is brief. We really only work with families in this capacity for a case plan for about 90 days. Which you can read more about on our website. And so I would try to see what brief interventions will help give them that stability, increase safety, right? And Luis's ability to nurture Gustavo. Somebody asked, if informal, does Luisa want guardianship knowing it could be indefinite? What's her capacity of caring long-term? That's a great question. And that is something that should be examined when talking about guardianship with a caregiver. You know, oftentimes caregivers may have to commit until that child is 18. And is that something that they can do and take that oath for, like a legal guardianship, which could also be like a conservatorship in other states as well, right? So that is a really great question. And that's something that we would really have to look at, which is why I always advocate for families to, like, in the beginning, let's try to get you as much stability as possible or present you with what's possible so then they can make that decision and plan accordingly. So our case plan for legal stability, I would have her look at guardianship options. You know, maybe mom and dad are generally easy to work with, have, you know, not severe mental health concerns. They're not aggressive or violent with at least Luisa or Gustavo. Perhaps a temporary guardianship might be okay, but I would probably recommend a legal guardianship without giving legal advice. For financial stability, I would look at cash assistance, SNAP, as well as adding Gustavo to her public housing when she acquires that legal relationship that's needed, at least here in Nevada, to do that. Parenting needs, I would sign her up for respite care, child support groups, behavior consultations, as well as referrals to therapy. And I would look at both like family therapy and individual therapy. And then for Luisa, she definitely needs support groups, right? To know that she's not alone. I think she's going to need more check-ins through one-on-one emotional supports and family events. You know, what are events in our community or events that we're holding at Foster Kinship to ease that burden, right? And put a little bit of fun in their life as well. Somebody asked, if no legal capacity was established upon child coming into care, could Luisa advocate for a formal case? So if Gustavo came to the attention of the child welfare agency, but nothing was established, possibly. It depends on the circumstances. If I were advocating for this family and it was a point of perhaps the family could be diverted into hidden foster care, there'd be a few things that I would want to assess, like when did Gustavo come into Luisa's care? How long has she been caring for him? I'd want to know more about the assessment of the CPS workers. I would probably chat with the CPS worker just to gain a full picture and see, you know, what those safety concerns look like. Thank you. So that's what I would kind of look at in terms of diversion, and that opportunity to perhaps advocate for a formal or informal case, depending on what Louisa was looking at. CPS workers love when I call them about that. So that is what my case plan would look like for Gustavo and Louisa. So as you guys can see, the disparities exist no matter what type of kinship care. But if we can have support in helping families, regardless of the status of foster care or not, kind of case plan to achieve stability, I believe our children will have better access to resources. I'm going to pass it off to Trista to chat now more about what families need and resources, and what are some really great policies and services that are out there for kids in kinship care. So I'm going to pass it off to her.
All right, you guys. So thank you again for being here with us. We're going to wrap up the rest of the day, just really following up on what Leah was talking about, right? She was talking about the case study with Gustavo, really talking about the technical pieces around resources, right? What our families need from a statistical standpoint, what are they lacking? And so we're going to talk about that more in a soft skills kind of way, right? What are the tangible needs of our families? So what do our families need? First and foremost, the things that our families need, right, is emotional support, and not just talking about the child or the biological parents, but our caregivers also need this emotional support. When we've talked about it and we've kind of alluded to it throughout the day, but if we ignore the feelings of our caregivers, then we can breed people who feel resentment. Maybe they get burnt out. This can lead to disrupted placements. And when we get into a kinship care situation, we have to realize that we are supporting the whole family, right? We're trying to support the caregiver to be able to have the child, to keep the child from entering the formal foster care system. We're trying to support the child, right? So that they don't have, overwhelmed by those trauma responses and, behavioral issues, things like that. We're trying to support mom and dad so that they can have a realistic view of what's currently happening, right? So that they can come up with a plan to come back to behaviors and decisions and actions that are safe and appropriate to have the children home, right? So we're looking at not just emotional support for the mom or dad and the child, which is usually who we're working with, right? If we're a caseworker or something like that, but we have to make sure that no matter what, we're always taking the feelings of everybody into consideration, and that we're offering that emotional support as needed and finding access to those emotional support resources. Mental health resources, right? Our families need a significant amount of mental health support coming into care, right? Or even, if we're diverted from foster care, moving out of your home into somebody else's home, even if they're your family, that's trauma. Changing your schedule to have a child be moved into your home, right? Sometimes having to make arrangements, for childcare and things like that without the funds or the means to do so. That's stressful, right? And so there's all of this trauma and stress happening, and we have to make sure that there is ample and adequate access to mental health resources and support. We don't want to be, judging people or make people feel like there's something wrong for them for needing this support. We actually really need to normalize it, and we need to, kind of be on the page that we understand that this is hard stuff. And this part of, this mental health resources and access and support is a normal piece to bring to the table to help you process and deal with that. We don't need to stigmatize it. We don't need to make it seem like, mental health is only something for our clients, right? We might need mental health resources too. We come into access with a lot of trauma, right? So we want to normalize that for the families that we're working with and make sure that they have ample access to take advantage of that. Educational support, We know that education makes a difference to outcomes, right? It improves earning potential. Young people who achieve post-secondary education are less likely to have children removed. And so education, there comes a host of benefits with that. And it's not always just post-secondary education, it's trade programs, it's anything that can improve the employability or career options for that young person going forward. Right. And for that family, sometimes mom and dad need some educational support. Sometimes maybe the caregiver needs some support in an educational fashion so that they can raise their earning potential to be a long-term support for the child and the biological mom and dad. Right. So that educational support piece for the entire family is imperative if we are going to truly address the issues that we're having and try to break those generational challenges, from being continuing to be passed on. Our families need ongoing training, right? Our caregivers, when we ask them to enter into this kind of dynamic, where not only do they have the kids before, right? They might have already had the kids in the past, but now we've got a legal, intervention where the child welfare system is involved in most of these cases, right? And if it's not informal, then we really don't have a change in dynamic at all. And we might have families that are enabling mom and dad. They don't know how to process with mom and dad or recognize, like Allie was saying earlier, the signs of when a parent, how can they show safe behaviors, right? All of those things. And so ongoing training around setting healthy boundaries, recognizing safe behaviors, how to engage in TBRI when you have your own resentment, right? Or your own guilt or things going on. Our families need that ongoing training around resources, around boundaries, around safety, and they need this ongoing so that they can feel empowered to really evaluate and help make choices for their families in their individual circumstances. Last but not least, I probably don't have to convince you guys of this too much, but our families need financial support. The data shows that when out of grandparents that have our kids, that have children in out of home placements, more than 20% of those grandparents live in poverty, and they just make it work because they love their kids and they love their grandkids. But if we truly want to empower kinship families to be able to keep children out of traditional foster care and mitigate and support birth parents to be able to reunify without, the child welfare system getting involved, we need to be able to offer some financial support to these families that are taking on these additional responsibilities to support their families, to support the biological mom and dad, to support the child. When we enter into traditional foster care, we recognize that need for financial support. We provide it to foster parents. We now, kinship caregivers can get licensed and receive some of that as well. If our goal, though, is to not interact, right, and to divert from the child welfare system in its entirety, there needs to be a mechanism for financially supporting families who do this on their own without getting the courts involved, without getting CPS involved. And so what's available, right? What is already out there to support children and families in out-of-home care? Tuition and fee waivers, right? There's currently 35 states in the United States that offer some version of tuition and fee waivers. I'm originally from Texas. Texas offers one of the most competitive tuition and fee waivers in the country. If you access your waiver before your 21st birthday, unless that's recently changed, I'm getting a little out of touch in my old age. But if you activate your tuition and fee waiver, it doesn't expire. I can get a bachelor's, I can get a master's, I can get a PhD, a law degree, I can start over. And so they have one of the most comprehensive tuition and fee waivers in the country. Here in Nevada, young people who have experienced care after the age of 14 can get up to 5 years of school covered. So it's 5 years of school, a bachelor's, or their 26th birthday, whichever comes first. Not quite as comprehensive as Texas, but still it's an educational resource that we offer. There has been studies done around the Texas analysis model that shows that of, young people who know about that tuition and fee waiver, they're 3.5 times more likely to access it, go to college, and graduate. So we do know that these kind of programs help. In Connecticut, we have a caregiver support team that we refer kinship families to. They meet weekly with the caregiver and have the caregiver identify areas of need where they feel the need, where they feel they need support. Social workers can also identify areas of need as well to be followed up on. Typically lasts 6 months, but you can request more time if needed. This is for licensed kinship homes. Yeah, and that's a great resource, right? Somebody that they can check in with regularly, no judgments, who can talk to them, who can figure out what they need. But like you said, that's for our formal families, right? For our licensed kinship families. So that's a challenge. But, and you're going to see that with some of these resources going forward. In addition to our tuition and fee waivers, we also have the Federal Education and Training Voucher Program, the ETV program, right? If young people age out of formalized foster care, they can access up to $5,000 a year up until their 23rd birthday. That's up to like 5 years, right? The way that you access this looks a little bit different in every state, but it is a federal program. So it is available in all 50 states. And so young people can, in some form or fashion, whatever the requirements are in their state, if they meet that, they can access these funds. Again, that requires that formalized placement and care though. Another service is the Foster Youth to Independence program offered by HUD, the Department of Housing and Urban Development. So basically what the Foster Youth to Independence program does is it offers housing choice vouchers to young people who experienced out-of-home care if they are between the ages of 18 and 24. They provide basically agencies that provide those vouchers. So it looks different in different states, but for the agencies that provide those housing vouchers, they are able to prioritize youth and young people who experienced out-of-home care and get them bumped up to the top of the list, get them those housing choice vouchers so that they can engage in rapid rehousing. Right. Sometimes we have to advocate for this because we don't always know. Kids don't always know about this, but this is a resource that's been available for the last several years and really helps. Housing, 50% of our young people, when they leave home, leave foster care, will may become homeless within 12 months of exiting the system. So this right here is a crucial resource to keeping kids housed, which allows them to focus on employment, education, right? And stop just surviving and being able to truly live, grow, and transition into adulthood. Medicaid, right? Our kiddos in care, they're going to get that fee for service Medicaid. And this isn't always available outside of the formalized, outside of, when youth are formally in care. Here in Nevada, if you've got young people in out-of-home care, we can try to apply for those Medicaid benefits. In some places, you need that legal guardianship or you need other, documentation. And so, but Medicaid, usually up until the young person's 26th birthday, if they've aged out of care, is a service that is available. And while it's not perfect, it does offer drastically needed access to mental health, medical, and dental resources. Independent living programs, right? For our young people that their permanency goal is extended foster care. If they're 14 or older, they're going to have, at least here in Nevada, it's different in different places. 14, 15, 16 is usually the norm. But there's various independent living programs throughout the country tailored to helping young people start to identify their support systems, start to build the skills that they need to transition to adulthood. There's usually some financial assistance that's available through these programs, some case management, right? And so this is another program that when young people have access to it, it really helps in improving those outcomes. The last one that I have here on my list today is Kinship Navigator programs, right? And this is, not exactly a new concept, but it's a fairly new concept. And, places here like Foster Kinship, we're kind of the middleman, right? People can come here and they can get formal assistance without necessarily making formal contact with the child welfare system. But we can also offer some monitoring, some of these pieces that people need, the training piece, the support piece, right? We can become very knowledgeable about what mental health resources are available. We can be the hub of that for our families, not just for our, our kiddos, our caregivers, and hopefully, at some point, our Kinship Navigator program also embraces and brings in the bio parents so that we're holistically helping the family heal and move forward so that this kinship arrangement can be successful going forward. Just real quick, let me ask you guys, because I only touched on a couple, right? What are some resources that you can think of or you might have in your area that are great for kinship youth, for families? What are some that you would recommend to individuals if they were asking? And I'll wait just a moment or two. So I know that like these services are fairly new, and the reality is, right, there's really not a plethora of them, right? I've probably covered most of the ones that a lot of us know about. Here locally, we do have places like Project 150, right? Which is clothing donations, mentorship. We see clothing donation centers, family service centers, right? These are some of those resources that we're starting to become more familiar with. Our foster care closets for clothes, things like that. We're trying to ensure that kids in non-parental care are able to get services, not just the one in the system. But that's hard to explain to our partners, right? When we start talking, Peggy's Attic, that's a good one. When we start talking about services and resources, some people say, well, there's a lot of stuff out there. I work with foster families all day. There's stuff everywhere, right? But for those of us who work with informal families as well, we know that a lot of those are specific to those formally placed young people in formal placements. Agency referrals to those in need from our caregiver support teams, right? Yeah, and we, in places where you can do referrals, that is a wonderful resource. If you can make contact with a family and see that they need something and you can, do that referral for them, that's a very empowering thing for you and the family. So what are some ways we can be better together? This is how I'm going to close out today. What are some ways that we can all be better in service delivery or access for our families that we're working with? The first thing is expand our services for informal families. Of all the services that I just went through previously, most, if not all of them, require formalized placement in the system to access these services. That is kind of a paradox because we're saying, especially with the family first, that our priority is diversion and keeping young people out of foster care. However, formalized placement is required to access all of the resources pretty much that we utilize once kids come into formalized care to support them and help them move forward. It would be very naive of us to pretend that those families who choose to work this out on their own with no oversight, with no intervention, don't need those same services. It would be very naive of us to assume that they don't need those same supports to ensure successful outcomes for their households as well. So we have to expand these services. The next thing we have to do is create programs that are tailored to where we are, right? We're here in Vegas. The same things that families need here in Vegas are not the things that our other liaison Rose, right, needs in Northern Nevada. They're not the same that some of you guys are going to need on the East Coast, right? In some areas, transportation is more of a challenge. Or like Audrey and Rose were talking earlier about the unique, challenges of rural, populations. We have to create programs that are tailored to where we are. We have to really take a look at what the needs of our individual communities are. And then once we know what the needs are, right, we look around, we find people that are doing those things really well, right? We don't have to recreate the wheel, but we need to take the time to individually dig in to our locales and where we are to figure out what the true needs are that we're addressing for our communities. If you try to cookie cutter approach, take a program that's working here in Las Vegas and take it somewhere other than Las Vegas, it's probably not going to be executed the same. It's not going to work the same. But what you can do is in other areas that need services that we provide really well, you could consult and look to us as a model for that and implement that piece, and then find another place that's doing something else you need really well and implement that piece, right? We can pull what we need to create tailored and customized solutions for our localized communities. We can encourage community outreach, church resources, pair with knowledge, right? Yeah, get our communities involved. Consider the unique needs of our population, right? All day today, we've been talking about how our families encounter maybe more trauma, right, than the general population. We've talked more about how those placement moves impact our young people. We've talked about the unique challenges that our families face in various circumstances, right? Right now, we're talking about the challenges they face accessing resources. We've talked about, how not having permanency impacts education. We have to make sure that when we set up these programs, we are considering the unique needs of the young people and the families that we're working with. Everybody doesn't have the same needs, and we have to make sure that we're truly meeting those needs before we execute and implement. Love the idea of mentors, more experience can, right? To help those new on the journey. I love mentor programs. It's a way to bond and build rapport as well. Consider the entire family your target demographic, right? If you're a child welfare professional, you may feel like your clients are the child and the mom and dad, right? Or the parent. If you're a Kinship Navigator program, you might say that the caregivers are your demographic, right? Depending on where we work, we might say that one piece of this is our demographic, either mom or dad, or the child, or the caregivers. But I would challenge everybody to consider that the entire family is really your target demographic, right? If I'm coming out and trying to provide educational resources, I not only want to sell the child on those resources, I also want to make sure that mom is educated on those so that she can be encouraging the child after we leave. I want to make sure that grandma is aware of those resources so that she can put her grandma love in there when I'm not there anymore, right? She can do what she got to do to encourage her grandbabies to take advantage of these resources. When we're talking about helping mom and dad, we need to also be helping the caregivers, because they're the ones that are going to continue either supporting or enabling mom and dad when we're gone. So we have to consider the entire family our target demographic. Make sure that we're maximizing outreach and recruitment efforts. I've been doing this work for a really long time. I was a child in care. I did as a young adult, I ran youth leadership groups. Now I do this work, and I hear over and over and over and over again from people that they do not know these resources exist. And for us who do this every day, it's like common knowledge to us. So we're like, we can rattle this stuff off. We know what's available. But outside of our bubbles, this is not widely known information. We have to maximize our outreach and recruitment efforts. We have to take that intentional time to get grandma involved and make sure everybody knows what those resources are. We have to make sure, because they don't really know. And a lot of times we assume people just aren't taking advantage of things because they don't want to or it doesn't fit them. But most of the time it's because they don't know that that resource exists, or they don't understand how they can qualify or it can apply to them, right? So we have to be very intentional to maximize our outreach and recruitment efforts. We need to combine services to maximize positive outcomes and provide wraparound services, right? When young people go into employment programs, they don't just need employment assistance. They usually need stress management. They usually need time management. They usually need, learning how to independent living skills, how to, take public transportation to be there on time. Children don't need just one service. They need wraparound services. They need the whole shebang, right? Our families need the whole thing. It doesn't help people when we have very siloed services, because there's only so many hours in my day. If you tell me, right? If you tell me that a service is available, or you tell me I can get education help, and then I go to get education or employment help, and through that I learned that I need stress management, but that's another class, and then I learned that, hey, I might not be very good at being on time, so I need some time management, but that's another class, right? You can quickly see that there's only so many hours in my day, and I'm going to prioritize whatever I consider to be the most crucial or imperative at that moment. If we provide and create services that fully encompass the needs of our families. So not only are we providing the educational or the employment services, but we are also incorporating those other things in that we need, right? That we know families need. Then we're more likely to keep families engaged and see successful outcomes than if we leave people siloed. We said, I can send a list of resources to families, and then they turn right around and ask me what resources are available. I think they are so busy with so many stressful things, they don't retain info. That's very true, right? You ever had a busy day? You're going, things are crazy. Sometimes I can't even remember what I ate for breakfast. If you ask me, I couldn't tell you what I had for dinner last night, right? So even when we do tell families about what's available, we have to keep telling them and telling them. We're trying to build habits, right? We're trying to build people that utilize their resources like a habit. Habits take time. It's a $1 billion industry, how to set up a habit, at least 21 days, right? It's what they tell us. So this is a long going process that requires consistency and thoroughness ongoing. We have to ensure that the services are rigorous enough to be effective. When I was researching for this slide, I was looking on the effectiveness of independent living programs, and there's not really a lot of research out there that measures their success. But one thing I found was that in one state, they did monitor an independent living program, and there wasn't really much to evaluate because the crux of their services was like sending out a newsletter and trying to engage virtually, right? They didn't get a lot of participation that way. We have to ensure that our services are rigorous enough to be effective. Kids need a lot of hands-on support. Our families need a lot of hands-on support. We were just talking about we can give people resources, and in the same breath that we just gave it to them, they've already forgotten. We have to make sure that our services are hands-on and rigorous enough to truly be thorough and effective for our families. Next, we've got to find community partnerships for long-term solutions, right? If I am offering an employment program and I tell kids and families, come learn how to be employable with me. What comes next then? I taught you how to be employable. Now what? Right? I need to take the next step if I can and make this something I'm striving to do, find employers that I can funnel these participants in to create jobs. If I'm doing education, right? Partner with a school so that young people can have a funnel into school. Whatever we're offering, try to find those community partnerships that allow us to offer a total situation or a total solution from start to finish. I'm going to offer you the education that you need around employment. I'm going to offer you the hands-off soft skills and technical support, right? I'm going to take into consideration you need that stress management, those other things, right? And then when it's all over, I'm going to help funnel you into a long-term solution to help ensure that it's successful outcome that we're looking for. This is a way that we can maximize our potential for success and our family's potentials for success in these cases. The next thing here is make sure that we're focusing on soft skills as well as technical training. I can teach people all day long how to write a resume, how to interview nice, right? But if they've got a lot of pent up trauma, and the first time that there is an unruly customer or somebody who's, maybe not being very polite today, if that triggers my trauma and now all of a sudden I'm cussing them out or yelling at them or causing chaos at my job, now I'm not employed anymore. It's very naive of us to think that just technical training is enough to ensure outcomes. We have to take into consideration the totality of where somebody is coming from and the exposure that they've had to healthy habits and maybe not healthy habits. And we have to focus on those soft skills as well as that technical training. Last but not least, right? We have to expand our Kinship Navigator programs. If our goal is to say that we want to promote, right? We want to keep reunification as a priority, but we also want to keep kids out of care. We have to find a middle ground. Families, if we are going to support informal placements, right? we've got to have the programs to do that. It is very beneficial to us at Foster Kinship to be able to say that we are a nonprofit in the community helping families and not necessarily a government organization, right? However, we also have the rapport and the technical expertise to offer some monitoring, right? The department, like we contract with them for licensing classes, so we can provide that training and expertise to people. Kinship Navigator programs can be a great middle ground for serving families without them having to come and formally enter the foster care system. Right now, we need to give Kinship Navigator programs, right, the tools to be successful. We need to ensure that there's robust resources that they can refer families to, or that they can access or get funding to do those things themselves, right? All the other things I said has to come together, but we can utilize Kinship Navigator programs as a vehicle for meeting families where they are while trying to keep them out of the formal foster care system. We can provide more formalized oversight, monitoring, support, help families figure out when mom and dad may be exhibiting safe behaviors, right? Or maybe when they're not, help them realize when we might be enabling instead of supporting. Kinship Navigator programs are a great middle ground for this. And so that would be not my last suggestion. I know there's a lot of suggestions, but that would be one of my main ones as well. And I think that's a great way for us to end today. This afternoon, over this whole day, we have talked so much about the various areas around kinship care, right? Around permanency, around reunification, this morning around trauma, now around resources. We have had a full day of kinship knowledge and resources and information. Before we close out our sessions today, does anybody have any questions, concerns, anything regarding anything that we have talked about? Again, if you guys were online and I could see you, I'd ask you to give me thumbs up. I think I also like Zoom better than Zoom webinar because I like to ask for thumbs up and know people can hear. But I really love the engagement that we've had today, you guys. Thank you so much for coming, for showing up, for participating, for engaging, and for really caring, about our kids, our families, and the services that we provide. I will thank you guys. We can just let everybody go. Is there anything else we need to do?
No, we'll send out evaluations next week with the link to the videos.
Awesome. So Leah just confirmed, I know she told you guys earlier, but just to confirm, we will have evaluations ready next week as when our videos go up on the website so that people can review those. Once you get those, if you're looking for CEUs, please return your evaluation to us. We'll get you your CEU certificate. Otherwise, everybody else will just get a general participation certificate. If you guys have any questions at all of anything that we've talked about today, please feel free to reach out to us at our email addresses. You see Trista at Foster Kinship here, Leah at fosterkinship.org, or our phone numbers. Those have been available throughout the day. So you guys, thank you so much for joining us. I hope you have a great holiday weekend. And I hope that you guys join us the next time. Thank you all. Have a great day. Oh.